Good morning, bon matin. Je m'appelle Yasir Naqvi. Je suis député fédéral pour Ottawa Centre. My name is Yasir Naqvi. I have the great honor of representing the riding of Ottawa Centre, which is just next door from here. And I'm also the parliamentary secretary to the Minister of Health. Before we begin, it's extremely important that we acknowledge that the land we're meeting on is the traditional unceded, unsurrendered territory of the Algonquin Anishinaabe people. The acknowledgement itself is important, but more than the acknowledgement is our commitment and recognition of the fact that Indigenous peoples have lived on this land for hundreds and thousands of years, and it's our duty and obligation as Canadians to learn from them, from their traditions, the rich culture, the history, so that we can, along with them, be better stewards of this land, and I make that commitment today. Thank you very much to Station 13 in Sandy Hill for their warm welcome, for having us in your beautiful fire hall. This is the riding of Mona Fortier, who's the local member of parliament, and she really, really strongly wishes that she could be here, but she's busy in a committee, but assures us her full support for what we are discussing today. I'm joined here today with my colleague, the Minister of Health, Mark Holland. Welcome, sir. A good friend of all of us in the room is Sherry Romanado, yes. The Parliamentary Secretary, the President of the King's Privy Council for Canada and Minister of Emergency Preparedness. I also am joined by many colleagues of mine that I want to recognize. Minister Harjit Sajjan is with us. Thank you very much for your service, not only as a parliamentarian, but to our country. MP Majid Jawari is here, MP Terry Duguid, MP Brendan Hadley is here, Senator Hassan Yusuf is here as well. Senator, thank you for the co-sponsor for this bill. Thank you for all the work that you continue to do as well. And also with us here today, special guests from the International Association of Firefighters, the Canadian Association of Fire Chiefs, and the Department of National Defense Deputy Fire Marshal. This is a really important day, because the announcement that we're about to make is, as somebody just said inside, would change the paradigm around firefighter safety. And all of us collectively, and I recognize so many faces here who've been diligently working day after day, year after year, in making sure that our firefighters who put themselves in the line of duty, who run towards fire as opposed to running away from it, are safe at all times. Last time I remember being in a fire hall like this was with some good friends like Fred and Carmen when I was Ontario's Minister of Labor, when we were recognizing presumptive legislation for cancer and heart disease for firefighters to make sure that we look after them in their time of need as they looked after us. And at the federal level, that work continues with even more importance and urgency. To talk more about what we are doing in terms of the work that Sherry started and what federal government is doing, I am so excited to welcome Minister Holland to come forward. He is the Minister of Health, have served as government House Leader, but most importantly is one of the most passionate and compassionate individual I know, who puts all his energy and might in any cause he takes over, and this is another example of that. Minister Holland.
Thanks so much, Yasir, and thank you for what you do as a parliamentary secretary. It's such an incredible honor to work with you, and you're so passionate, and today is a great example of that. Thank you to Station 13 for hosting us today. I also want to thank some of the folks who are with us today who are so important to this conversation. Chief Paul Boissonneault from the Canadian Association of Fire Chiefs, Ed Kelly, who's the General President from the International Association of Firefighters. There you are. Ed, thank you so much for coming here. I know it's on short notice. It really means a lot for you to be with us today as well, from a long way away. I want to thank the Canadian Cancer Society. I want to thank the Canadian Partnership Against Cancer. I want to thank all of my colleagues who are here today, and I know that they've been recognized, but there's a couple of people I really want to say a special thank you to. Sherry, I'm going to come to you in a minute, because this is really, none of us would be here today if it wasn't Sherry, and so I'm going to speak about that in a second. But I want to talk about Harsh as well, Minister Sajjan, who's, as our Minister of Emergency Preparedness, just gets it, understands the essential role firefighters play, and is literally everywhere in this country, making sure that we respond appropriately to disasters and that the people who walk into danger are taken care of. So, Harsh, thank you. It's pretty timely. This is Fire Prevention Week, not just here in Canada, I believe across North America, and we know every day what firefighters like the ones here do to keep us safe. And a lot of times we think of the dangers they face in terms of a burning building that they might go into, or a wildfire that they put their lives at risk to keep our community safe and to save lives. But sadly, really the number one taker of life is cancer. And that's something we have to look directly in the eyes of. And that's what today's about. Mais chaque jour, dans les communautés, dans chaque province et territoire de notre pays, les pompiers, comme vous, mettant leur vie en danger pour faire leur travail. Plus de 126 000 personnes travaillent comme pompiers au Canada et plus de 70% d'entre eux sont des bénévoles. Et, and so maybe I'll just put this in really personal terms. One of the really great things you get to do, I get to go to the graduation ceremony for new firefighters coming in Ajax. And I had an opportunity, 13 new firefighters coming in. And to listen to the conversation about the camaraderie of that program together, but also as they look down the corridor of their careers, what they're hoping to do. And how moving it is to hear them just so rooted in service. The idea of putting their community first in everything they do, personally and professionally. And you ask, as you sit in a room like that, what do you owe to people who are willing to put their community first in that kind of way? And I think it can be put simply, which is if they have our back, we have to have theirs. And I'm approaching 50 in a week, so you get a bit contemplative. When I was, I don't know, maybe it's 5, 6, 7 years ago, I can't remember the number of years, but we lost Arnold Chan, who is one of my closest friends in this world. And he's somebody who really embodied that spirit. He was my mentor. He's somebody who always put service first. And I watched firsthand losing Arnold to cancer. And I'll tell you, that sits with you every day. And as I approach 50, I think about all the years I hopefully am going to get with my family, all the experiences I'm going to get to have that Arnold didn't get to have. And it was just a few months ago, I was at a funeral of a firefighter who died of cancer. It was a cancer related to his work. And I thought a lot of Arnold, thought of Arnold's family, and I thought of the family of that firefighter. And I want to tell you, somebody who thinks a lot about those things is Sherry Romanado. And Sherry said it's essential that we do everything that we can to keep firefighters safe, that we have a national framework on cancer so that you don't have some hodgepodge situation where you get a cancer in one jurisdiction that's appropriately recognized and not in another. That we need to have a registry for all cancers to make sure that we know exactly what the underlying causes are, and we're working as a full society to make sure that we keep firefighters safe. So when they charge into that building, they're worried about the immediate danger. They're not worried about the long-term danger. That's something we need to take off of their shoulders when you charge into those rooms. And let me tell you that Sherry viscerally understands this. And all of my colleagues here can tell you, if Sherry sees any one of us in a hallway, what are you doing on this? When are we announcing? How much is going to be there? We got to get this done. And she's the reason we're here today. All credit to Sherry for pushing and fighting and scraping. And the fact that we're not just announcing this framework, but that it's fully funded, demonstrates that the Prime Minister, Justin Trudeau, understands intimately just how essential this framework is. So I want to thank Sherry. Notre espoir, notre intention est que ce cadre guide la collaboration avec tous nos partenaires et conduise à progrès tangibles pour les pompiers. Cela comprend l'effort d'organisation de pompiers, des chercheurs, des prédécesseurs de soins de santé, des partenaires autochtones et tout l'ordre du gouvernement. With these partners, we've made huge progress in supporting firefighters and their health and their safety for this country. This framework is a continuation of that. And I could talk about things, but I don't need to talk about the things that we've done. I think folks know it. You want to hear what we're going to do. And let me acknowledge that here. This is a starting line. It's not a finishing line. We're not here to slap each other's backs and say, job done. We're here to say we're making progress together to what needs to be done, to what we owe one another, to that commitment to have your back in the way that you have ours. And so it is my profound honor and privilege to see this legislation tabled today, and it's even more my honor to introduce my friend. I got to work so closely with her in the House Leader's office. She's a force of nature, and she's the reason we're here today for this announcement, MP Sherry Romanado.
Thanks so much, Minister. Merci. Good morning, everyone. I'm incredibly happy to be here with you all today. Before I begin, I'd like to highlight the presence here at Station 13 of some really key people who helped make sure that this framework could be brought to fruition. IFF General President Ed Kelly, Paul Boissonneault, representing the Canadian Association of Fire Chiefs, from IFF, Carmen Santoro, newly appointed assistant to the GP, Sean McManus, the legal counsel, Neil McMillan, thank you so much, Neil, Denis Charbonneau and Dan Johnston of the Canadian Fallen Firefighters Foundation, Denis Doucette, vice-président SST de l'Association des chefs de sécurité et incendie du Québec et chef de service de sécurité et incendie de Gatineau, Chris Ross, président de l'Association des pompiers de Montréal, Mathieu Doris, président de l'Association des pompiers et pompières de l'agglomération de Longueuil, dans ma circonscription. Jean-François Couture, pompier de Longueuil, et l'inspiration de mon projet de loi qui a mené à ce cadre national. Merci beaucoup, Jean-François. And of course, Senator Hassan Youssef, who sponsored and championed C-224 in the Senate. Please forgive me if I've omitted anyone, but know that every firefighter and firefighter community representative in this room has contributed in some way, near or far, to making this day a reality. I thank each and every one of you from the bottom of my heart for your support. This is truly a monumental day. In 2022, I introduced my private member's bill C-224, calling for the development of the first ever national framework focused on raising awareness and sharing information with the goal of improving access to cancer prevention and treatment for all firefighters in Canada. La loi obligeait le ministre de la Santé à impliquer les gouvernements provinciaux et territoriaux, les instances dirigeantes autochtones, les professionnels de la santé, les scientifiques et les membres de la communauté des pompiers dans le processus d'élaboration de ce cadre. Depuis la sanction royale de juin 2023 et au cours de la dernière année, Santé Canada a soutenu l'engagement des partenaires et des parties prenantes, notamment lors de divers ateliers organisés conjointement avec l'Association internationale des pompiers et l'Association canadienne des chefs de pompiers. The framework outlines 6 pillars to support all firefighters' health and safety and will present analysis and opportunities to inspire collective action to better protect firefighters from occupational cancers. So what the Minister is announcing today, all of the 6 pillars are included in the framework, including research on cancers linked to firefighting, research in cancer prevention and data collection. We heard you, Neil, loud and clear on the importance of creating an inclusive national firefighter cancer registry, and that is reflected in this pillar. Training and education in healthcare settings, diagnostic testing for firefighters, information and knowledge sharing, and finally establishing standards on health and safety and workers' compensation. The implementation of this framework presents a foundation for collaboration, information sharing, and stewardship to raise awareness and support collective action to address cancers linked to firefighting. Barely a month ago, I stood at the Canadian Fallen Firefighters Memorial as we paid tribute to 160 firefighters across Canada who had died in the line of duty, most of them from the occupational illness, whose names were being added to the wall. Our goal with this framework is to ensure that fewer and fewer names make it onto that wall every year. To those who are currently fighting the good fight and to their families, please continue to focus on your health and your recovery, and know that we will keep pushing to make sure you have the supports you need. À ceux qui mènent actuellement le bon combat, ainsi qu'à leurs familles, concentrez-vous sur votre santé et votre rétablissement et sachez que nous continuerons à faire tout ce que nous pouvons pour que vous puissiez bénéficier du soutien dont vous avez besoin. With today's announcement, Canada is a trailblazer in implementing this national framework on cancers linked to firefighting. It is my hope that other jurisdictions will look to us as a model and follow our example. In closing, I'd like to take the opportunity to thank my colleagues in government for supporting me through this journey, and particularly Minister Holland and Prime Minister Justin Trudeau for believing in the importance of this initiative. Thank you. Merci. I now turn it over to my colleague and friend, Ed Kelly.
Thank you, Sherry. You're the best. Merci, Sherry. Bonjour. Again, my name is Edward Kelly. I have the honor of serving as the General President of the International Association of Firefighters, serving and protecting 350,000 families that protect all the citizens in our two countries. You know, our job, firefighting, is inherently dangerous. But that doesn't mean we shouldn't do all we can to make it safer. And it takes more than firefighters to make our job safe. It takes a commitment and action from our elected officials. Today's announcement delivers on a promise from the Government of Canada to combat occupational cancer in the fire service. To Minister Holland, Parliamentary Secretary Naqvi, our sister, Sherry Romanado, who led from the front, thank you very much, for seeing this national framework through to where it is today, fully funded and completed as the work starts. As we stand here in Station 13, it wasn't that long ago that when the bells went off in this station and the people in this neighborhood needed help, our brother Ryan Hill answered that call, climbed on these trucks, put his life on the line. I'm sad to tell you that 2 years ago, Ryan lost his battle with brain cancer. As sure as he's missed in this fire hall, he's missed a lot more at home with his wife and twin boys, then 4 years old when they lost their dad. You know, Ryan spent 10 years answering these bells for the people of Ottawa. And I know that the framework that is being put in place today will save the lives of future firefighters that will follow in Ryan's footsteps. Thank you, each and every one of you, for the work you've done to make that happen. Cancer is, sadly, the leading cause of death among firefighters. We know it doesn't have to be. Progress can and is being made. But this threat, which has been recognized by the World Health Organization's IARC, which is the International Agency on Cancer Research, firefighting in the act itself is a Class 1 carcinogen, the most dangerous that there is. Unbelievably, the bunker gear that we wear, our personal protective equipment, is laden with carcinogens during its manufacturing process. Dangerous chemicals like PFAS are actually embroiled into the fabric of our PPE. Ottawa is leading the way on making that change. We have 5 cities in North America, Ottawa being one of them, that is testing PFAS-free gear. Firefighters face many threats when we go out the door. Taking on cancer is our #1 mission because it is our #1 killer. And with partners like those we have here today in the Government of Canada, Minister Holland, Parliamentary Secretary Naqvi, and our own Sherry Romanado, you're making our job safer. And I thank our IFF leadership, Sean McManus and Carmen Santoro from Canadian Operations, Neil McMillan from Health and Safety, our 13th District Vice President, Fred LeBlanc, who represents Ontario and Manitoba, and our 15th District Vice President, Chris Ross, that represents Quebec and the Eastern Provinces. And as a small token of all of the work that you've done to make this happen, I hand you this priceless membership card as an honorary member of the IAFF, Sherry. Thank you, man. Now you have a parking spot. I ain't sitting there. Thank you.
It's my pleasure to introduce Paul Boissonneault. Paul.
Thank you very much. I was looking forward to President Kelly's pronunciation of Boissonneault. Minister Holland, MP Sherry Romanado, friends at the IAFF, including President Ed Kelly, Chief Hutt and the Ottawa Fire Service, our hosts today, IAFF Local 162, members of the press, distinguished guests, what a great day for firefighters in Canada. On behalf of the Canadian Association of Fire Chiefs, the National Association representing the country's 3,200 fire departments, volunteer, composite, and career, and our President, Chief Ken McMullen, we thank the Government of Canada and all parties for their support of this bill, this work, and this announcement during Fire Prevention Week, no less. Au nom de l'Association canadienne de chefs de pompiers, qui représentait les 3200 services d'incendie volontaires, composites et professionnels à l'échelle du pays, et de son président, le chef Ken McMullen, nous remercions le gouvernement du Canada et toutes les formations politiques pour le soutien apporté à ce projet de loi, le travail accompli et l'annonce faite au cours de la semaine de prévention des incendies rien de moins. In their effort to protect people, property, and the environment, firefighters are exposed to carcinogens. Unfortunately, too many firefighters have been afflicted. Fortunately, action is being taken. To my colleagues who are battling this occupational disease, to those who have survived it, and to the family and friends of colleagues we've lost, this is for you. To the Health Canada staff, MPs of all parties, Minister Holland and MP Romanado, thank you for bringing this to life. To our government leaders in provinces and territories, neither fire nor firefighter cancer recognize jurisdictional boundaries. Please work with your provincial and territorial fire associations to make sure no firefighter in Canada is left behind. Conscient que nul le fut, nul le risque de cancer au sein de la profession ne connaît de barrières juridictionnelles, nous invitons les chefs de gouvernement dans les provinces et les territoires à ouvrir le cancer avec leurs associations de pompiers respectives pour s'assurer qu'aucun pompier au Canada n'est laissé pour compte. When MP Romanado put her bill forward, she promised that this would be nothing about us without us. She and Health Canada kept their words and kept their promise. With Health Canada's support, in particular from James Morden, Miranda McPherson, and Nina Dobin, CFC hosted workshops where speakers and members from the fire service from all types of fire departments, Indigenous and non-Indigenous, wildland agencies, firefighting schools, and industry reflected on multiple topics. This framework today captures all of this. Finally and importantly, as today is Fire Prevention Week, I have two final messages. To our friends and policy leaders in government, and all across parties and all federal departments, again, we thank you. Fire chiefs are here to help you and to make this cancer framework a success. But please remember that from cancer to wildfire to electric vehicles, lithium-ion batteries, new construction materials, single means of egress, to rapid housing development, explosive, green technologies, this framework will evolve rapidly and the challenges of the day will be replaced by new ones. We are asking you to install a National Fire Administration to help you coordinate all of this. We will be there with you every step of the way. Finally, and most importantly, to the beloved members of the public and all Canadians, we prevent firefighter cancer when we prevent fires. This Fire Prevention Week and all year round, please choose wisely. Make sure you have working smoke alarms, carbon monoxide detectors, and home escape plans, and that you've practiced them. Connect and call your local fire department for safety information. Your life could depend on it. Thank you. Merci. Miigwech. It is indeed my honor to introduce the next speaker, Deputy Fire Marshal Benoit Gagnon.
Member of Parliament, esteemed member of the press, honored guests, good morning. Je m'appelle Benoit Gagnon et j'ai le privilège de servir en tant que directeur adjoint du service d'incendie pour le ministère de la Défense nationale et des Forces armées canadiennes. Mon parcours dans ce domaine a commencé il y a plus de 33 ans, en tant que pompier volontaire au début des années 90. Une époque où on en savait beaucoup moins au sujet de la santé et de la sécurité des pompiers et pompières. The National Framework on Cancer Linked to Firefighting is a pivotal initiative that aims to significantly reduce and prevent the exposures of current and future generations of firefighters to harmful combustion products and their byproducts. It is essential that we address the fact that many firefighters have historically operated without adequate protection or awareness of the impact of these substances that can have on their health. Among the key pillars of this framework, efforts towards health and safety standardization and bring key people together to improve workers' compensation access across Canada, as well as an enhanced diagnostic for testing firefighters. These initiatives align closely with our national mandate on hold the potential to make a substantial difference in the lives of both our civilian and military firefighters who are tasked with safeguarding Canadian Armed Forces infrastructure from coast to coast to coast. While we currently have programs aimed at reducing exposure, this framework offers a more comprehensive solution so that we can all act together, because that's the goal and that's how we can have all a bigger impact. Ces dernières années, j'ai été profondément touché par les réalités du cancer présomptif au sein de notre confrérie. Je pense à mon premier lieutenant Sylvain, qui est tragiquement décédé d'un cancer il y a 2 ans, ainsi qu'à mes collègues actuels Tammy et Brian, qui ont courageusement gagné leur lutte contre cette maladie. Mes souhaits de rétablissement vont également à mes confrères de la communauté, Clay et Robert, qui ont récemment été diagnostiqués et qui suivent actuellement des traitements. Ce ne sont là que quelques-unes des nombreuses personnes courageuses que nous avons perdues ou qui continuent de mener ce combat. I firmly believe that this framework will play a critical role in reducing the toll of this devastating work-related illness, raising awareness within our firefighting community, and encouraging firefighters to adopt educated measures in their daily life-saving work. Thank you for your attention, and I look forward to working together to ensure a safer future for all our firefighters across Canada.
Well, thank you very much. Merci beaucoup to all our speakers for the important and inspiring words. I think one message you've heard loud and clear, that this is about safety, protecting the lives of our firefighters who work hard every single day to keep us safe. And this is the beginning of the work. This is not the end, as the minister said, and there's a lot of work that we will continue to do so in collaboration with all of you. This is the time where we get to answer questions from the media. I believe I'm looking at Matt, who's going to take it over from here, and we will follow his instructions. Thank you.
Welcome, everyone. Bienvenue à toutes et à tous. I'm Minister Holland's press secretary. Je suis l'attaché de presse du ministre Holland. We will begin with questions in the room before going to questions on Zoom. Please state your name, media outlet, and to whom your question is directed. You will have the opportunity to ask one question with one follow-up. Nous commencerons par les questions dans la salle avant de prendre les questions de Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question.
Hi, Minister Mackenzie Gray with Global. On pharmacare, it looks like there'll be a vote in the Senate this week. Do you have any timeline on when you'd expect it to get royal assent? And for folks at home who might be wondering, when can Canadians expect that they'll be able to get any drugs through that program?
Well, thank you so much for the question. I just want to first recognize my colleague, Joyce Murray, who joined us and has been a wonderful champion on this issue. Thanks for being with us, Joyce. On the issue of pharmacare, look, it's been a lot of work to get it through the parliamentary process, first through the House, and I want to thank all members who supported the initial steps, regardless of what party they were in, to recognize that people who don't have access to essential medicine deserve it, and that should be a fundamental Canadian value. And so moving in that direction, I really want to thank first parliamentarians, Senator, through you to all your Senate colleagues, thank you for the work that's been done in the Senate. It appears that we will be out of the Senate on the 10th of October. And so that now turns to provinces and territories. And while the parliamentary machinations have been rightly going on, we have been working diligently with our provincial and territorial colleagues, getting ready to make announcements. And so it's my expectation that we'll move towards announcing concrete deals very shortly after royal assent. And I certainly encourage all jurisdictions to get this done. This is, today we're talking about saving lives. I think it's essential in our health system, just as we're talking about today, to be upstream, to be taking action. It's apropos that we're talking today about saving firefighters from cancer. Well, we have to think writ large about how we stop folks from getting cancer. 70% of chronic disease and illness is preventable. And I think our hospitals are replete with people who shouldn't be there. So in terms of when medicine is going to start arriving, now it's up to jurisdictions. It can happen as fast as they can sign deals, as fast as we can get them done. We're ready to get to work. We're ready to see these drugs flow because they're going to save lives. And importantly, it's going to save a mountain of money. Let me just take diabetes. $30 billion a year. That's how much diabetes costs this country approximately. It's increasing every year by an order of magnitude of billions of dollars. And that's because diabetes is a precursor illness. It is a precursor to so many other chronic disease and illness. If we don't manage that disease, then it's going to cost us. Cost us in terms of social justice, cost us in terms of dollars. So that's a transformation we must and will make.
You're going to have to negotiate with the NDP, likely, to be able to keep the government going. Of course, pharmacare is one of those things that has been a key priority, you working with them. Are you willing to increase the number of drugs that are available in pharmacare as a part of a deal to keep NDP support going forward?
Well, it's important, and I said this from the beginning, as I was having the conversations with Don Davies, this was a floor, not a ceiling. And one of the reasons that we in BC did the Memorandum of Understanding was to help illustrate the fact that we can have more ambition in these provincial deals than what we did in Ottawa. As a case in point, how exciting was it to be at BC Women's Hospital talking about menopause hormone therapy? It's so essential to women. Women will spend about a third of their life in a postmenopausal state. That transition is so important to their health. So seeing that that's part of the BC plan is extremely exciting. And as we move through these agreements, we're really working to show more ambition than what was there. That's up to the provinces and the territories. We're coming forward with large support, large dollars to help do this. We're looking for provincial and territorial partners to meet that ambition. Because I think we can show in data and evaluation and in science how it improves lives, how it saves lives, and how it reduces costs.
We will now proceed to questions from journalists online with Zoom. Nous allons maintenant prendre des questions des journalistes sur le Zoom.
Thank you very much. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Our first question comes from Palak Mangat of Parliament Today. Palak, please go ahead.
Hi, Minister. Can you hear me okay?
I can.
Hi. The Canadian Chiropractic Association wants the government to expand student loan forgiveness eligibility to its members. Obviously, this list was expanded in the spring budget bill, which has now passed, but the group is calling this an oversight that its members are not included. So is your government open to this?
Well, thanks so much. Well, let's talk about the loan forgiveness program because it's so important, right? I mean, this is a program that says for rural and remote communities that we're going to forgive loan of students who move to rural and remote communities to serve those communities in essential areas of underserved health. So this is doctors, nurses, hygienists, dentists, right? It's physiotherapists and others, so that folks can be connected to care. And it really, again, is in the spirit of prevention and being upstream. So we're always evaluating on a data and science driven basis, what is the need and how do we get there? And certainly for rural and remote communities, they have very special needs. And so we're always evaluating what policy levers we can activate to connect people to care. So that is an iterative and ongoing process. We've identified some of the highest priority areas, and it's going to really help with making sure that folks have access to a doctor, a nurse, to a hygienist, a dentist. It's an essential complement to the work we're doing in primary care and in dental care and in pharmacare. But we're always looking at ways we can improve it, and of course we'll be looking at that on an ongoing basis.
And just as a follow-up, so you're saying that you're open to that. The move today is supposed to cost $301 million over 4 years. So that's what was expanded through the spring legislation. How much, can you maybe speak to the costing of bringing in another profession, and could this spark calls from other professions?
Well, let me pull it up a little bit higher, and then let me try to connect it to today. I think of this as a conveyor belt of progress. What can we do right now that's going to have the biggest impact to help people? How can we, as a government and as parliamentarians, meet the moment that we're in? These are some of the most challenging times human beings have been in since the Second World War. How can we demonstrate to people that we're making progress in dealing with the issues that are most important to them? And so what we're doing is we're trying to move everywhere all at once on the most essential and important things. Today is a clear example of that. This is something that we've got to get right. You know, we've got to make sure that that firefighters who are going into harm's way are not thinking about more than the immediate threat that's in front of them. We need their families not being up at night worrying about them. Right? We've got to take those burdens off their shoulders. Everybody would agree that's an immediate priority. Everybody would agree that the work I hope that we're doing on dental care, that somebody, you know, for 40 years not having a pair of teeth in their mouth, they're down to plastic plates that they're painfully crushing food with, deserves a pair of teeth in their mouth. That somebody in a primary care environment deserves access to care so that they can be referred to a specialist before that small problem becomes a big problem. Right? This is all stuff that's immediate. So that's the lens we use. So, you know, one of the hardest things is that you sit through these circumstances, we can't fix everything, right? You know, there's all kinds of problems that we're not going to get to right now. It doesn't mean we don't care. It just means that we've got to get to the biggest priorities first, and that we've got to chop through them and move on that conveyor belt of progress so that people can see that we're getting to all issues. And so I don't know, you've raised an additional issue. I've said we're always open to iterative progress. I'm not at a point where we've done kind of costing on that. We've got a lot of other things in front of us. But I acknowledge that the issue is an important one to raise.
Thank you, Minister. There are no further questions online, so that'll conclude today's news conference. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.